Decatur County Memorial Hospital in Indiana has been working to reduce their total patient harm rate.
My name is Linda Simmons. I'm the President and CEO of Decatur County Memorial Hospital in Greensburg, Indiana. We're a 25-bed critical access hospital. I think what I'm most proud of is that we've kind of come together, both our physicians that we work with and the senior staff and the frontline staff, and really collaborated on the efforts that we've been putting forth to create a safer place for our patients. It was kind of an aha moment for me was when we really started working on the getting rid of the early elective deliveries. Our physicians, when we talked to them, were waiting for us to be able to step forward and do that. It kind of took the monkey off their back. It was amazing to me how much they kind of all came together and said, you know what, this gives us something to push back with when our patients are putting a lot of pressure on us to do the early electives. We can say, hospital policy, best practice says we can't do this. So it was a good moment to see that, you know, if we do work together and we get everybody's input, a lot of times there's synergies that can be gotten there to make a better step forward and outcome. I think the biggest impact in kind of putting everything together and showing that there are lots of different pieces that can cause harm is that it helps to bring it together instead of segmenting it. We get so caught up in healthcare and in hospitals that, okay, we start this initiative and we're reporting on this, and then we start this and we're reporting on that, and it gets so fragmented that everybody looks at a lot of things as being on their plate, and then things start to tumble off because you're looking at where to put your energies and efforts. And as you roll all of that in, and we say that we're looking at harm across the continuum, across the whole board of the patient's experience in there, it becomes everybody focusing and looking at things that might cause harm, things that might cause failures in our systems, instead of looking at it as, oh, we're looking at falls, or we're just looking at washing our hands, or we're just looking at this. We're looking at anything that could cause harm to the patient. So it kind of pulls it all together so we don't feel so fragmented. I think one of the key points when you're looking at harm is to personalize it, because we can put a lot of data and numbers out there as we collect it, and that doesn't mean something to somebody. Okay, so we had one incident this time or 2 incidents this time. When you start putting a name to that, especially in a smaller community, we're a 25-bed critical access hospital, it's a small community. Most of the people are related to other people there, or it's the best friend of another relative of theirs. So when you can make that personal and you can put a name to that, then it starts to sink in that, you know what, that's not okay because that was someone that I knew. It becomes real easy to write off 1 or 2 numbers, but it's not okay to write it off, and it's hard to write it off when it's someone that you know, and it becomes a personal issue with that.